You even had one chiropractor that didn't want to touch you. He was afraid to touch you.
Yeah.
I don't know what to say about that. That's shocking to me. I mean, he's afraid to touch you because he saw your MRIs, which showed a few disc herniations and a few disc bulges. Yeah. But that's crazy.
He said
to be
it was
afraid to adjust you. Then what? Why are you even a chiropractor if you're afraid to touch somebody with a disc herniation? Dr. Dave here with Synergy Wellness, Chiropractic and Physical Therapy in New York City. We have Boris here. Boris came in to me with something that we commonly see. You can pick up the 3 pairs of shoes. Okay. We commonly see in the office. Do you wear sneakers or no? Don't press that. Yeah. Here, so do you wear sneakers at all or just boots?
Oh,
casual?
Yeah. And sneakers.
Okay. Now hold on one sec. Don't press that. Come on off of there. Just stand right here. So he came in. What's a little bit frustrating is he's seen medical doctors. He has seen physical therapists, chiropractors, acupuncturists, and it's a little discerning hearing some of the things, the stories that he's telling me about. But let's get right to what's going on with him, okay? Go ahead. Why don't you tell everybody you have a lot of chest pain, rib pain wrapping underneath the armpit.
Yeah, so I have chest pain mainly on my right hand side. It feels like it's pulling. I feel it in my upper back, my mid back, and it's been going on for over a year. And I've seen numerous doctors, chiropractors, acupuncture, and I found Dr. Dave on Facebook actually.
Now, this all started with pneumonia, right?
Yeah.
So he had a case of pneumonia, and then after the pneumonia, that's when all of these symptoms started. He gets some, I'm just going to fill in some of this. Some people tend to leave certain things out, but he gets some mid-back pain, and he just told me that he once in a while has had the feeling of a light heartburn, acid reflux, and that's another condition with acid reflux and hiatal hernia that we see a lot of. And we have some cases of people with hiatal hernia, acid reflux, and costochondritis. And that's what's going on with him. He has costochondritis is just inflammation of the rib area or the rib area where it meets the breastbone. He has that. He has a lot of tension. If you notice, his shoulders come in. He's got incavatum, so his chest kind of comes in a little bit. And then if you face that way, right there, you can see right through here, and go ahead and bend forward, touch your toes. Right through here, his back takes a big sharp bend, right at that level. So come on back up, and right at this level, if you come back around, this is where the ribs are to where he complains of pain, okay? And there's a direct relationship, again, and we've done so many videos on this, with the thoracic spine and the rib cage and the chest pain, but also if you zoom in here, you'll see his clavicle is off. So the clavicle on this side is lower. But we need to make sure that it's this side that's lower and not this side that's higher, right? So we're going to run through some tests and check that. What I want you to do is just bend your arms and just go like this with one arm, as high as you can. Okay, and the other one? Is there any restriction on that one? Yeah. So it's probably this one. We'll focus on this, but we want to just double check and make sure. So he's got some limited range of motion there, and we're going to have you turn around and face the window. And his scapula is lower on the right side by a little bit here. This side's lower. Okay, so we got a few things to check out. So first we're going to start him on the foot scanner here. So come on over here. And yep, right foot on the clear window, left foot on that clear window. Look straight ahead, arms at your side. So this machine's great. It'll scan the feet and it'll look at all 3 arches in your feet. The medial, the lateral, and the transverse arch. So we're going to read that with him and take a look. And that can have a lot to do with his knees and ankles, but also his lower back and pelvis. Okay, good scan. Okay, now I'm gonna have you turn and face me right over here. Turn your whole body down. Great. How tall are you?
6'4".
6'4", okay. So we also have an MRI. I'm not gonna share all the details of his MRI, but we have a thoracic spine MRI that's positive. Okay, look straight ahead, arms at your side. Just gonna take a better look at your posture there. Okay, great. All right, come on off of there. And you could sit right here facing the computer. Sit in the chair sideways, yep. You're a little bit flat-footed, just so you know. We'll go over it a little bit more next time, okay? And now what we're gonna do is we're gonna scan his back, checking for inflammation and muscle spasms. Okay, now we're gonna take a closer look at Boris's back and what's going on with the muscles. This scan will check for inflammation, but also we'll check for muscle imbalances, muscle spasms, muscle tension, and muscle weakness in the back and along the paraspinal muscles. And some of you may be able to see this screen right behind. I'll try to raise that up so you can see that while we're scanning him. So he has had an MRI, not a X-ray. X-ray would tell us if there's any scoliosis going on, which is pretty common with these cases. Okay, you ready? It doesn't hurt, by the way. Okay. Palms in your lap, feet flat on the floor, and palms facing up. Yeah, good.
L1. T1. C2. Left C1. Right C1.
Okay, so it did show some moderate to severe inflammation on the left side. This next scan is taking a closer look at the muscles. All right, so we're going to run this, start at S1, go all the way up the spine. And lines here, you'll see a red and a blue line. The red line shows the left side of the muscles here. The blue line shows the muscles on the right. And we want to see both lines overlapping each other, one on top of the other. That means they're balanced from left to right. But also we want to see it lower here in the graph. Okay, and as we get towards your middle back, you might see the lines a little bit higher up. That's normal, okay, for our postural muscles. So we'll go ahead and start at the lower back and go all the way up. And right here, there you see the blue line coming down. Keep it on here for a few seconds. Okay. And as you can see, that little green bar there on the side of the spine on the right, in the lower back, shows some mild muscle tension there. Same thing with L5. And then from here on up, we skip every other vertebra. We can do every vertebra as well, but it's just not necessary. Really what we're interested in is what's going on with your middle back, those muscles, right?
Yeah.
So there is some mild muscle tension on that right side in your lower back, and it looks like it's continuing. And it looks like it might be even a little bit worse. See the gap between that blue and red line there in the graph? So it tells me that the muscles are pulling even more now as we climb up the back, and then you see the blue bar there, right? That tells me it's a moderate muscle spasm or moderate muscle tension. And now we're at T12. Not as bad there.
T10.
And as I said, we skip every other vertebra. We'll want to keep it on here for a few seconds. Good.
T8.
And this can also tell me if there's muscle weakness. But what it cannot tell me is if there's scoliosis. And you see here,
Yeah.
it switches. The left side
That's worse.
now becomes
T6.
tighter. See right there, the red?
Yeah.
It's severe muscle tension. The opposite is mild tension. So both sides were tense in that area, but much more severe on the left side. Yeah, and same thing right here. To get, they had asked before, any shoulder pain?
On the right side.
On the right side. So not only chest pain, but he gets shoulder pain as well. You can see here again, it's switched to, well, that looks a little better. Okay, good. Good.
T2.
So at this point, when I see tension on one side and then back on the other side, I want to check for scoliosis. Your shoulders are not far off, they're mild. So it could be a really, really mild case of it. And that's maybe what's causing your rib cage to come out of place and create some of this, some of these problems to get worse, and the tension into that right chest to get worse. So we'll check for that in a minute here. Okay, good.
C7. C5.
Well,
Do you get headaches?
no.
Okay. Any neck pain?
No. When it gets inflamed, I feel it, but other than that, no.
Okay. So occasional neck pain?
Yeah.
Yeah, there's some imbalances there.
C3. Left. C1. Right. C1.
Okay. So, not bad, but not great either. Severe tension in the spots where you see the red. Mild muscle tension in those areas where you see the green. And let's pull up the views here. Okay, so now that we've done the scan, you can see, you can even zoom in here, but you can see your scans here, okay? So your first scan is the inflammation scan. It showed mild, green, red is severe, blue is moderate, mild to moderate to severe inflammation. But that really tells us more about your autonomic nervous system, which controls your glands and your organs. I'm really more interested in these scans up here. This is what a normal looks like. This is your scan, okay? Now, when you see black, that means it's off the charts. It's in spasm. Right across that middle area where we showed where you had that hunched over posture,
Yeah.
in that exact area. And then right above it is severe muscle tension, severe muscle spasm. And on the opposite side, really mild muscle tension there. And then you also had it across the top of your neck, which isn't that uncommon with cell phones and laptops that we're using, and even more so now. but this is what a normal scan looks like. And then you also had some mild muscle tension on the right side of your spine, and then it switches back to more severe. You had nothing on the left in the lower spine, then it switches back to the left. So I want to check you for scoliosis, because if you look at this scan here, this shows, this upper right one shows the asymmetry. So it shows pulling in your lower back. See the blue there and the red?
Yeah.
So pulling in your lower right back, and then pulling in the upper left. And that, to me, when I see that, I think scoliosis. So we're going to have you stand right here facing the computer. Yep. And I want you to go ahead and bend forward and touch your toes. Okay. So we're going to use this scoliometer just to take a look and make sure. And here it's 5 degrees. So right here in his lower back, you can see it's at just about 5 degrees difference. If we go here, it's less than 5 degrees. So as we get up here, it's 5 degrees. Let's check this. And that's less than 5 degrees. Okay, that's good. Good. And right up here, it goes up to 4 degrees in his upper back. So, come on and stand up. My guess is that you have a mild scoliosis. Not a severe case of it, a really mild curve, and that's what's going to exacerbate or aggravate a costochondritis, mid-back pain, that tightness you get on one side. So what I would like to do is take an x-ray here in this situation, okay?
Okay.
All right. So we have digital x-ray here. It's 30% less radiation, and we'll be able to see the image right afterwards. All right, so I'm going to take a x-ray, 17-inch here, to try to get in as much as the thoracic spine as we can. So we're going to try to get in your lumbar spine, the top of your lumbar spine, and your thoracic spine.
Raise my hand.
Nope, you're going to relax just like that. If you could, take your shoes off for me. I didn't realize you had your shoes on. Just kick those off and place them over here. And you're going to stand with your feet shoulder width apart. Yeah. And then feet in a little bit more. And then toes in 10 degrees. Good. Lock your knees straight. Good. And hold that position right there. Take a deep breath in and blow out. You can breathe normally. Just put a shield around you here. Okay. So you're going to tie it in the front. Go ahead and tie that in the front. Okay, now we're going to spin it around. Good. Lock your knees straight. Yep. Toes in. Good. Look straight ahead. Take a deep breath in. And blow out. Now we're going to have you turn and face that way. Step forward. Put your arm right up here, and your left arm up there. Good. And take a baby step forward. Okay. Another baby step forward. Good. And deep breath in, blow out. Okay, so here's your spine, your lower spine. You can see that the spine right at about right where the ribs start. See that? See how it tilts a little bit? And that's when your spine shifts slightly to the left. But it's so slight. And that scoliometer machine I showed you, that shows that there was just about a 4 to 5 degree curve there. And it just wasn't picked up. But up here in your thoracic area where the ribs are, you can see it's shifted more to the left. And that would make sense as to why you have tension more on the right side. Okay, Boris. So your right leg comes up short. It tells me your pelvis is pulled back on this side. And I can just tell by looking here while you lay down, your pelvis is higher on the left side. So I'm going to have you lay with your right side up. You've probably had your side posture adjustment before. You've been to other chiropractors before. This is your first adjustment. I know you've been through a lot of going to different physical therapists, acupuncturists, chiropractors. We're going to address this a little differently. We just saw your x-rays. We saw a little bit of a curve in the spine. And we'll talk about how you can work on that on your own outside of the office here. Okay. And we're going to fix this problem for you, okay?
Okay.
All right, take a deep breath in and blow all the way out. Good, and the other side up. Have you ever had that kind of adjustment?
Similar. I mean, didn't feel as good.
Okay, so you even had one chiropractor that didn't want to touch you. He was afraid to touch you.
Yeah.
I don't know what to say about that. That's shocking to me. I mean, he's afraid to touch you because he saw your MRIs, which showed a few disc herniations and a few disc bulges. Yeah. But that's crazy.
He said
to be afraid to adjust you. Then what? Why are you even a chiropractor if you're afraid to touch somebody with a disc herniation? You probably shouldn't be a chiropractor at that point. So it's good that you moved on from him. Take a deep breath in. Good, and blow all the way out. Okay. We're going to do a special technique. You okay?
Yeah.
Okay, we're going to do a special technique for your thoracic spine because of the disc herniation. So we're going to take you into another room.
Okay.
Okay. So, because you have several disc herniations in the lower back, yes, you can have costochondritis, and that can cause the inflammation and the tightness in the chest, but also the nerves in the thoracic region not only start in the thoracic spine in your mid-back, but then they wrap out through the nerves, and they can create pain into this area as well. And those are the intercostal nerves. Inter being in between, costal, spinal rib. Okay, so go ahead and lay on your stomach. Definitely the preferred technique for people suffering from disc herniations, disc bulges, failed back surgeries. This is the technique. So we're going to start up higher with him. I'm standing here on his left side because his spine got a long left scoliosis. He's also 6'5", so how you doing there, okay?
Yeah.
And what we're going to do is I step on this foot pedal and it pulls the table out a little bit. My hand here, and then we're going to traction out the table for him. here, this whole table stretches out right here. And then we're going to bring that table back in. And then out again. Doing okay?
Yeah.
We're going to let the table back in again. And then back out again. Okay, and then back in. What I'm doing is going through each thoracic vertebra here, tractioning out each segment. You might feel a release or a click. Have you felt that at all yet?
No.
Doing so far?
Okay.
Any increase in chest pain?
No.
Here. Okay, keep your legs straight. Raise one leg as high as you can. Keep the whole leg straight. So you're going to raise the whole leg up as high as you can. Good. And down. The other one. Good. And relax. There's a lot of muscle tension right here on that scan. It showed a lot of muscle tension here on the right from here to about here.
Yeah.
Then it switched over to the left side right about here. Okay, take a deep breath in, bend your knees. Good, deep breath. And blow all the way out. And drop your legs down. Good. Move your, or turn your face to the left. And compare that and turn it to the right. Is it harder to turn it to the left?
No, it's tighter to the right.
To this side?
Yeah.
Turn it back to the other side again. Okay, and back to center. And take a deep breath in and blow all the way out. Now turn your face to the left and then the right. How's that?
No, it feels the same.
Good. Okay, turn over on your back, please. Hands up in the air. Check your shoulders and your elbows. So arms out like this. Resist me. 1, 2, 3, resist. I'm going to push down. Ready? 1, 2, 3, resist. Okay, I heard something click on that side. Did you feel that? It might have been your elbow joint. Something shifted there. Relax here. Okay, now I'm going to test this shoulder a little bit more because we found the clavicle low on this side. So lock your elbow, palm facing out. And 1, 2, 3, resist. I'm going to pull out that way, then I'm going to pull this way. So resist me. Ready? 1, 2, 3, resist. That's the best you can do? Wow, okay, that's weak. 1, 2, 3, resist. Okay, and relax that arm. Let's test the other side. This arm, lock the elbow, palm out. 1, 2, 3, resist. That's much stronger. This side is really bad, yeah. 1, 2, 3, resist. Okay, and relax. So we clearly have to adjust that clavicle. So we're going to go ahead and do that. Since it's your first time, I'm assuming none of the other doctors adjusted your clavicle?
No, never.
Okay. I'm going to use this. It makes it a little bit easier. Not that much easier, but next time we'll use my hand. Okay, now we're going to put that arm up. So this was really weak. We're going to test it again. Ready? 1, 2, 3, resist. Better, but still weak. 1, 2, 3, resist. Relax here. Sore in here?
No, it just feels still slightly tight.
Resist. A lot better. 1, 2, 3, resist. Okay, how does that feel? Was it painful?
In the neck?
In the shoulder. You didn't have any neck pain, did you, when I did that?
No.
Okay. No shoulder pain on either one? Okay. This is definitely stronger, but I want to check the SC joint. So stand up, face me. Definitely better. Okay. Not 100%. We're going to check that again next time. You sure you never hurt this shoulder? Is this
The left-
clavicle, if you look here, this clavicle here sticks out.
On the left side?
Yeah.
I never heard.
Never had a basketball injury or anything like
No,
that?
I love it.
Okay. All right. Go ahead and lay on your stomach one last time. And turn over on your back. Scoot down a little bit for me. Good. Cross your arms in front of you. Like this. Tuck your chin down. And come on up. Have to sit up. Deep breath in. And blow out. You okay?
Felt that one.
Where'd you feel that? Besides in your back. You feel that in your rib cage?
I felt it like right here.
Okay. Yep. Hands up in the air. All right, we did a lot today. So we've got some things to go over next time, okay?
Okay.
All right. Thanks for letting us videotape this so we can
Thank
show
you.
everybody else.
That's good, doctor.
All right, you're welcome. Thanks for tuning in.